Are you waking up with neck stiffness? Arm feels heavier than it should. Fingers are starting to tingle, get numb on you. Does this sound common? Is this something you're getting? Cervical stenosis mornings have a signature that lumbar stenosis patients do not have. And if you're having this, you need to watch this video because I'm going to show you today my top 3 morning stretches for any patient that's suffering from cervical stenosis. And this will be a game changer for you, and it will set your day in the right manner if you do this. My name is Dr. Ali Shariff. I'm a local chiropractor at Infinite Healing Chiropractic Wellness Center, and I'm located in Oshawa, Ontario. And before we start, I'm going to ask you to like this video. I'm going to ask you to subscribe to this channel because I'm going to keep on pouring out more and more content that you will be informed with on how to take better care of yourself. Now let's understand what's happening to your cervical spine. The morning presentation happens because the cervical nerve roots at C5, C6, and C6, C7 have spent a night in a slightly compressed position. That overnight stillness allows inflammatory mediators to accumulate around the compressed neural tissue. And that's why you feel that stiffness, that tightness in the morning. The cervical spine carries a head that weighs about 4 to 5 kilograms at neutral posture. But this becomes significantly more when there's forward head posture, when you start bringing that head in front of your shoulders. So today I'm going to show you 3 stretches every morning that you can do that's going to help you with this. 5 minutes. That's all it's going to take. 3 stretches every morning that could change your life. The cervical spine is far more position sensitive during your sleep. Think about this. A pillow that's too high, a pillow that's too low, your neck position is going to be off. A sleeping position that keeps your neck in rotation or lateral flexion for hours, or a sleeping position on your stomach that requires your head to constantly be rotated throughout the night, which is a terrible position for your neck and not the one I recommend. Could you imagine how this is affecting your life? So think about this. If you had to look this way and you had to look this way consistently for 6 to 8 hours, how sore would your neck be? Now think about that sleeping position. What are you doing to your neck when you're in that position? Or if you're in the fetal position, you're on your side, but your head is dipped forward. Could you imagine if you're like this for your whole day? How are you going to feel? How is your neck going to feel by the end of the day? So when you wake up in the morning and you've been in this position for an extended period of time, is it a surprise that you're suffering from the symptoms you're suffering from? Now, the one thing to understand is all of these produce sustained loading on the C5, C6, and C6, C7 levels during nighttime. So here's another factor too. When you're talking about sleep, here's the next one, the weight of the head. So another factor is general anterior head carriage. The cervical spine has a compressive load on its head, 4 to 5 kilograms at neutral position. Now, this is going to increase if you have forward head posture, and it can increase to 7 to 9 kilograms with every centimeter of head forward position. Could you imagine that? So every time your head is moving forward, you're progressively putting 7 to 9 kilograms of more stress on your spine. That is huge, and you're carrying that around throughout the whole day. No wonder your neck and your shoulders are sore. Now, factor number 3, the deep cervical stabilizer muscles. The deep cervical stabilizer flexor muscles, the longus coli and the longus capitis, stabilize the cervical segments and maintain neutral cervical positioning that protects the stenotic canal. And so it protects it from extension, and forward head posture creates more stress on it. So in cervical stenosis patients, these deep stabilizers are chronically underactive. Throw in then the combination of forward head posture, throw in any type of sleep issues that you're having too, you now have chronic nerve root compression that is occurring. So every morning, these muscles wake in their underactive, inhibited state and immediately begin the day without any stabilizing support that they are supposed to be providing. So it is a shock to the system when you get up and you start moving around. So the chin tuck, the second stretch in this morning protocol, helps to address this. I'm going to be showing you 3 stretches in sequence that I want you to be doing. So I'm going to show you 3 stretches that I want you to do in sequence that's going to be important to set up your morning protocol. The first is going to be the towel traction. And this towel traction is a decompressive state that you're going to apply to the cervical spine. And that's going to help it get prepared and relaxed, but be more prepared for the first compressive load that you are going to start your day with. So it gets your neck and your spine prepared for your day. Now watch while I show you how to do this. What I'm going to show you is a cervical traction stretch. Great for people that have C5, C6, C6, C7 issues. It helps to decompress that spinal canal. So let's show you the cervical traction stretch. Basically what you're going to do is you're going to take a rolled up towel and you're going to grip that underneath the occiput area. And once you've got it there, you're going to then have a gentle distraction up. But before you do, you're going to tuck the chin in and then distract up. And it's a great stretch for that cervical area that you can do. So you can do it seated, you can do it standing, you can do it any position because it's all requiring just upper body work. So the cervical towel traction, 3 sets, 20 to 30 seconds. The next is the chin tuck stretch. That's your second stretch. And unlike the towel distraction, which is a passive decompression, the chin tuck is an active neuromuscular exercise. It is the cervical equivalent of the standing pelvic tilt in the lumbar morning protocol. So how do we do that? Very, very simple. Watch this video and you're going to be able to do this stretch. It is extremely simple to do. So this stretch is called the chin tuck. And basically, the premise of this is that it helps to realign your head over your shoulders. It helps to decompress the cervical discs and reduce some of the shear forces on the spinal cord nerves. It's a small movement, but done consistently can make a big difference in your posture and your symptoms. So basically how you want to do this is you can do it while you're sitting or while you're standing. I prefer doing it sitting. You look straight ahead. Gently slide your chin straight back as if you're trying to make a double chin, but don't tilt your head up or down. And you want to hold that position for about 5 to 10 seconds. And then you want to relax. And then you want to repeat it again. And you want to do it 10 to 15 times. Now, here is the clinical mechanism. The chin tuck activates the longus colli and longus capitis, the deep cervical flexors that sit in front of the cervical vertebrae when active. This maintains the cervical spine in its neutral position rather than forward head posture that leads the C5, C6, and C6, C7 levels into an extension. So in cervical stenosis patients, these muscles are chronically underactive, and the chin tuck is a targeted activation exercise that reestablishes the function at the start of the day. So if you're thinking about this and you're thinking about these muscles, the longus colli and the longus capitis muscles are in the front of the cervical spine. They help to keep it in its neutral position, and this is where you want them to be the strongest. But when you start to dip your head forward, and your head is now forward in front of that spine, not only are you increasing the weight of your head on your neck and your shoulders, which is going to fatigue your shoulders, it's going to activate your shoulders, it's going to cause your shoulders to get sore and your neck to get sore, but it also puts that C5, C6 area, that bottom area, which should be flexed, into more of an extension position. So the weakening of those muscles can also affect that. And so the chin tuck exercise that I give you is to help bring this neck back and to help strengthen these muscles. Now the third stretch. The third stretch addresses a specific aspect of cervical stenosis that neither the towel traction nor the chin tuck targets directly. The cervical neural foramen, the lateral opening through C6, C7. So that side area of C6, C7 where the nerve roots are exiting the spinal canal on their way to the arm. This is what it's addressing, the side area. And so It is cervical lateral flexion. So watch while I show you how to do this stretch. And again, this stretch can be done when you get up in the morning, but it's also a stretch you could do if you're a desk worker, sitting at the desk and stuff, taking a little break and doing this stretch. Watch while I show you how to do this. When tight, sitting or standing upright, gently drop your right ear towards your right shoulder. Do not rotate. You're just doing a sideways tilt. And you can even get a further stretch by putting your hand on your head on the same side and just pulling it just a little further. You're going to hold this for 30 seconds. You should feel a gentle stretch along the side of your neck. Switch sides, and you're going to perform this twice on each side. Here's the clinical mechanism that makes this level specific for C5, C6, and C6, C7. Let me grab my spine here. Lateral cervical flexion, okay, let's say to either side, to the right or left, produces a widening of the neural foramen on the opposite side. Because if you're going to be flexing to one side, you're going to help open up the other side. So again, if you're going to be flexing to one side, you're going to help open up the other side. And that's why you're doing it both sides. So cervical towel traction, 3 sets, 20 to 30 seconds, decompresses the C5, C6, and the C6, C7 canal before the head is upright before the day starts. Chin tuck, 10 repetitions, 5 seconds each. Activates that deep cervical stabilizer muscles before that forward head pattern starts to take over. And then you have the cervical lateral flexion, 20 to 30 seconds each side. Opens that foramina where the C6 and C7 nerve roots are exiting. 5 minutes. That's all it's going to take in your morning. 3 stretches. Your cervical stenosis morning protocol starts today. So today is the day you start these 3 stretches every morning, and they're going to help to address these clinical symptoms that you are suffering from in cervical spinal stenosis. It helps you manage what you're going through before the day starts, with all the loading that you're going to be going through, with all the activity that your day is going to demand, and thereby your body can handle this. Applied consistently every morning, they produce a meaningful, different starting point for the C5, C6, and C6, C7 nerve roots than waking immediately and beginning the day without any cervical management protocol. What they work around is the structural narrowing of the cervical canal and the foramen. But now let's talk about the one thing that they don't do, that may still be occurring, that is still affecting you. The disc degeneration that's reducing that disc height. It's still there. It's not gone. The joint osteophytes, the bone spurs that are encroaching on the neural foramen. That's still there. That's not gone. The ligamentum flavum that's thickening, if it is, that reduces the central canal space. Again, that's still there and could be growing. The facet joint hypertrophy that narrows the lateral recess where that nerve roots are exiting. That's still there. These structural realities that still exist, even though you're doing these stretches, bring you to the next point, clinical intervention. You should be combining your stretches with the care of a chiropractor. I am a chiropractor. I see this in my clinic. That's why I can advise on this. You need to ensure those spinal joints have proper motion. Any restrictions in those spinal joints can affect your progress. So the combination of all of that together is what helps you through the day. 3 stretches, 5 minutes a day, every morning before your head carries its full day. Incorporating a therapy protocol with a chiropractor familiar with cervical spinal stenosis. Your arm symptoms in the morning, the heaviness, the tingling, the finger numbness, are the cervical nerve roots that are screaming that they are compromised. And that's why you need to be doing this protocol. This morning protocol gives them the decompression, the stability, and the foraminal space that they need before your day happens. I hope you found this video to be educational. I'm going to ask you to share this video with others. I'm going to ask you to like this channel. I'm going to ask you to subscribe to this channel because I'm going to keep on putting more and more content out there. My name is Dr. Shariff. I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic and Wellness Center. Looking forward to seeing you in my next video.